first topic, Zeph, is what's AFT's position on reopening and starting face-to-face instruction ASAP?
Right. So thank you, Mark, for this opportunity. And to answer your question, I would say as a matter of principle, no, we're not ready. We should not be opening now. As a matter of fact, even President Trump recently came out and said schools and school districts in hot zones should not be reopening. So it's really hard to call from state to state. There are plenty of states across the country who've done what they needed to do to get the virus under control. And they may have places within those states where they can try to reopen. That's why it really needs to be focused on a local level. It needs to be directly driven by the health professionals in that area that have a very clear handle on what the level of COVID, the response rate is in that local community. But states like ours, Texas, Florida, Arizona, California, hell no. We chose to prioritize opening bars, which is what's put us in the current position that is jeopardizing a safe start to school. And no one, frankly, should be opening where there hasn't been at least 14 days of declining positive cases, where there is less than 5% positive new cases and a 1% overall rate. Those were the numbers from the CDC before it became co-opted by politics. And I think that those are some fairly smart numbers to at least start looking at and keeping aware of right now of what's happening in your community. But opening where at least those levels of numbers haven't been achieved is a guaranteed way to increase COVID within that community.
Yeah, I'm glad you brought up actual benchmarks because I don't feel like there's enough conversation about that. We just get derailed by you know, almost like it's a moral issue when really it should be a scientific issue. So can you repeat one more time, Zeph, and then we'll go to Michael. One more time. What, it's 14 days, and I know there are some groups trying to build consensus around that benchmark. What was it again? 14 days.
Well, that's it. Some of the ones that we've been looking at here in Texas, particularly in Houston, 14 days of declining positive cases, no more than a 5% overall, 5% new cases that are coming up, and no more than a 1% overall within your community. Those were some of the numbers that we've been looking at, and we're in. We did community plans in San Antonio and in Houston where we brought in stakeholders to start looking at these numbers. And you exactly brought up a great argument. We're spending far too much time talking about arbitrary start dates. Those are the wrong numbers. We need to be focused solely on the numbers of spread, community spread in our area, solely on the numbers that medical professionals feel we can rationally control, that are going to reduce the potential for new cases to happen, and certainly the ultimate worst, which is one of our students on our watch or one of our colleagues on our watch actually succumbing to this virus. That's the most important thing. That's the factor that we've got to pivot back to and stop relying on this, frankly, artificial start dates across the country, whatever they are.
Michael, did you have a comment?
Yeah, I wanted to add, you know, how much can we really rely on his leadership? Because I recall that was the prerequisite to open the bars and restaurants, a 14-day decline. Governors ignored it. They opened up anyway, and he went ahead and praised them for doing it. And so that's where we're at. And the other thing I would mention is we don't have the testing infrastructure to contain the virus. That say you're in a region with low infectivity. Let's say you open up the schools, that could be a super spreader situation. It only takes one person infected and it could spread throughout the community there. So, and this isn't even an experiment. We've tried it in other countries. They've tried it in other countries. Israel was a good example. There was also South Korea. They had a much better handle on the virus. They opened up the schools and it was an abysmal disaster and they had to shut it down precipitously. So I would also mention that. So even if, you know, it seems like Trump is making sense and he's putting a mask on now, I don't know how much you can rely on any consistent leadership from the federal government.
So I have a question for both of y'all and Mark as well. So I guess particularly for Zeph, what recourse do teachers have that are facing this situation with districts that are not giving any leeway with start dates or anything like that? Is there anything that teachers can do, not only in the state of Texas but throughout the country?
Right. So there's varying levels of that to really be able to answer that question. And I want to start off with clarifying for Michael. I completely hear the concerns about trusting anything that is, said without necessary backup. I'm completely not saying that Trump is doing the right thing now, just merely acknowledging that even he is saying we shouldn't be opening in hotspot schools now, which should be a non-starter question for anybody. But those that are still insistent on following unsafe practices, not listening to medical professionals, moving forward, I think that those teachers that are in those districts have got to become vocal. They have got to speak out. You still have a right to push your local school board members, to push your superintendent, to pull together evidence-based facts and information, to make alliances with like-minded parents and others that feel the same way that you do, to make sure that that voice is out there. One of the big things that we've seen coming up, I understand that there are a group of parents that want in-person education to start, and this was one of the questions that I just sent back to one of their leaders. Why are we fighting one another over when to start in-person learning when, frankly, all of our teachers want to be back in the classroom? Why are we fighting each other on when we start that? And why are we not working together to push the state government to do what is needed to get this virus under control? That's what we all have in common. And that's what's not happening here in Texas and in other places as well. That needs to be our priority focus for everyone. Step number one is force the state to take the necessary decisions to get this virus under control so everybody can go back to work, so everybody can do what they need to do. Short of that as well, though, I think that there are some individuals that really need to take a look at what some of the legal guidelines that were passed in the Corona Crisis Families First Act that can be helpful. If you are a teacher that has any type of pre-existing conditions that put you into a higher risk category, you actually have the potential and opportunity that I would immediately be getting with my doctor, filling out or completing an Americans with Disabilities Act request to continue to teach virtually. If you don't have those issues, or it's not you or somebody from your family, because only the ADA only applies to the employee themselves, it's not perfect and it's not the end case, but understand that you have an additional 10 days of COVID related leave that may be able to utilize as well if you don't feel like you're able to come back because you've got somebody at home that may be in that higher risk level, or you've got kids that you're trying to watch out for. Districts are not necessarily telling people about that, and they may have to push for it, but they have those additional days.
Is that Texas or nationwide?
That is nationwide. That is a nationwide piece of the Families First Act that they would need to take a look at. We actually had our general counsel for Texas AFT come on a webinar a few weeks ago where we actually went through both of these provisions in detail. So I would recommend, anybody, particularly from the state of Texas, but most of these two, because they were federal acts, are applicable across the country. They can find that resource on our COVID resources page at texasaft.org.
Okay, thank you, Zeph. I want to pause and say a couple of things. First, on the topic of teachers wanting to go back to work, I want to speak on behalf of teachers I know and work with. We all want to go back to work.
Yes, we do.
And what I foresee happening is, because we did not do the things over the summer that we needed to do, just like when we give summer reading assignments and the kids don't do it, they waste the whole summer and show up unready to take that reading test. Our leaders did not use this time this summer to properly shut down like they did in Europe. As a result, and as a result of going back too soon, what I believe will happen is the hospitals will crash, districts and schools will have to be forced to shut down once again, and it's going to be, who knows, maybe the spring before we really get back to teaching. Not because we don't want to, but because we're not doing things in the proper order, and we're not following those scientific medical benchmarks that Zeph talked about really well, of 14 days, 5% new cases, was it? We're at the, what, 15% in Houston plus. So it's not that we don't want to go back to school, it's that we see this train barreling down the road, and it's going to force us to stay out of school even longer, and it's heartbreaking. So back to that topic, Zeph, of what we can do to protect ourselves and our families as teachers, advocating for ourselves, use our voices on a local level with our admins, school boards, alliances with parents who understand and care about our health and safety as much as they care about childcare. And what else should we be doing in terms of what should we be documenting? And I don't know. This is not something I normally do. I'm not a teacher who thinks about the legality of things. I just like to teach.
Right.
But now I feel like we're in danger and we need to.
Well, I mean, and this may be a bit premature, but at the point where people do go back, or if there are people out there who are still being required to go back, they need to be asking for proper safety equipment. They need to be making sure that their employers are providing those pieces. If they're not providing masks, proper cleaning, paper, like literally this was part of the issue. In March, our schools didn't have paper towels and soap in the bathrooms. How are we supposed to trust that they're actually going to have masks or proper cleaning to get things done? If they're not doing those things, those are exactly the things that must be documented, must be shared. Everybody that's working in those environments should be documenting those things down, because the first thing that is going to happen is you're going to have an uphill fight where they're going to want to deny that this is a workers' compensation issue. Please let nobody be out there, be under the misconception that workers' compensation is going to protect you if you get sick when you have to go back to work. This is one of our major concerns, because we are deeply concerned they're going to look at it like the flu or the cold or anything else. You could have gotten this anywhere within the community, therefore it's not tied to your work. So the better you're able to document whether your work has actually done the things necessary to keep people safe, whether they're violating social distancing requirements, whether they're not providing that necessary equipment, where they're not allowing you to, on a regular basis or hourly basis, whatever that rule is in your area, to make sure kids are washing hands and getting those things done, that where they're not bringing in people to clean up on the in the common areas immediately after they're used. All of those things should be documented, because you're going to help protect one another by everyone documenting the same things, being able to share those same informational pieces and activities. I wanted to kind of go back to some of the things that AFT's been doing from the beginning, from a nationwide level, just to kind of give that perspective. So hopefully it will help people have some ideas about what they should be doing first. First and foremost, you know, we have healthcare workers in our union, and we're one of the largest healthcare workers across the country. And they were some of the first frontline workers having to deal with this. And they walked into employers and government agencies that weren't providing the proper healthcare. AFT invested millions in making sure that they got that safety equipment to their employees. And if we find ourselves in that place, you know, I guarantee you we will be pushing to hell and back, and everywhere we can. We went worldwide searching for N95 masks, searching for the proper gloves and what have you to provide to our members. So we know that that is still in the background that we need to be paying attention to. We're not just relying on employers without trying everything that we can do to make sure that that's taken care of. So I applaud the AFT for stepping up on that. That work with our healthcare professionals allowed them to have a place and a voice to inform us of what a safe reopening plan could look like, or the framework for one that should have. So anybody who's out there who has not gone to the AFT website and downloaded the AFT reopening framework plan really should do so, because it will help you provide a framework and a set for looking for those things that you should be documenting, looking for those things that school districts and employers should be doing to keep people safe. And that was what we actually used as one of the framework pieces to develop the Houston plan that we put out to HISD and others, San Antonio did, and locals around the country have been doing with their safe reopening plans. Just like what you were talking about with the documentation, AFT really helped us in getting and using the bully pulpit of the media to try to make sure that we got the message of teachers out there, to make sure that they were sending letters to the governor, engaging in those collective action pieces, because collective action can be much more than just work stoppages. It is, how do we develop a common voice and amplify that voice as much as possible? That's what helped us get the flexibility to change some of these plans across our state. And we may have to. We're not taking off the table that we may have to file legal action. In Texas, it hasn't been as, you know, we were able to get more flexibility than they were in Florida. And so Florida, they've had some provisions within their state constitution that has allowed for some potentially good legal challenges. We're looking for those in Texas. People should be looking across the country. People are going to be in very different places because of what the circumstances are on the ground. But certainly where those options are available are things that we're looking at. So that documentation that you're talking about now could be very helpful to us in the future if we have to go to that next step, because they refuse to close back schools if we see virus spiking within our members or within our students.
Yeah, if things go as badly as I mean, all the science seems to be saying it will. You know, we're already in our Facebook groups. You know, so many teachers are talking about quitting, furloughs, taking massive amounts of time. I mean, doing whatever they can to protect themselves. And I anticipate that there will be a lot of union members looking to their unions to, and you can only, of course, speak for AFT, but looking to their unions for representation and support. Is AFT ramping up its capacity for dealing with that influx of requests and needs?
Yeah.
As far as hiring lawyers or whatever it is you do.
Right. So there's a couple things about that. One, we're actually going to be in national convention all week, and I expect that more information will be coming out on our response to COVID, because it's somewhat taken over the focus of everything right now. So there definitively will be, you know, resolutions that become orders for our national organization and what we're willing to do to help our members, and understand that the way that we work, our local entities drive the work. Our local members are the ones to decide. And we've made a commitment at the Houston level that nothing is off the table. We will do and support our members in any way, shape, or form that they're ready to move. But we want to make sure that whatever it is that they do, they're doing it with eyes wide open. We're very transparent about what the pros and cons could be, or potential consequences of any of those actions. To kind of, to your point about new people coming in, this is why it's so very, very important to talk about collective voice and coming together, because there's a capacity issue. Our members who have built the organization and have supported it have got to have some level of priority, but we're also going to take care of everybody who comes in new as well, to the best of our abilities, to the point that we have the capacity to do that. There's always a capacity issue around that. When people ask what their dues cover, what their dues help do, they help increase that capacity level to be able to meet the needs of everyone. So that is definitively something that is on our mind at the local, state, and the national level. Right now at the state level, our focus is and is going to be not just the kind of, you know, insider issues that are more important to educators and parents about what TEA is doing, but frankly, we've got to move the narrative to the government and of the entire state, to the governor's house, that frankly, they've got to do what needs to be done to get the virus under control. And exactly what we were talking about earlier is they need to do the shutdowns that are necessary to do that. They need to move forward with those pieces that impact all of us, not just in education, but everybody across the state. Because if they don't do that, if we don't get it under control, we're going to constantly be back battling this up and down, back and forth, start and stop that doesn't help anybody. And that's where we're going to need the support from the local level, is to make sure everybody understands that there's tough fights ahead, and that's where it's going to start and end.
Right. And I wanted to ask you a question about economic loss. So when this thing does crash, can they hold our certificates if we decided we didn't feel safe? Are they able to hold that over us? Because I have a lot of people, they confide in me that, man, I feel like I'm being held hostage. I have to go in, or else I'm going to lose my livelihood and my income. And I'm just kind of like, that's a terrible situation to be in if you don't have the means to support yourself or another job lined up. What are you going to do? You're going to be afraid to speak out. And another comment I'd like to make is about the testing. Now, now, a lot of people are citing the American Academy of Pediatrics, but if you look at their guidelines, it says you have to have a testing infrastructure. How is that going to work with the testing? How are you going to get adequate testing? Right off the bat, I don't see how it's logistically even feasible.
Well, and I don't, it's right now it's not, particularly because I don't think that schools have really made provisions in any of the plans. Houston has one of the better plans, along with some other large districts, and that part is really outside of our purview in many ways, because it is up to many the other agencies in our work collectively with the county, with the city, and the state, to make sure that those testing centers are where they need to be. This is problematic countrywide, particularly statewide, which is why our perspective has to be do what needs to be done to get the virus under control, not just making policy for schools and what happens over here, because we don't teach in a vacuum. Our schools aren't in a vacuum. They're part of ecosystems that are directly impacted by all of the other decisions that we make. I wanted to kind of speak to your other issue, Michael, as well too. The issue of having your certificate sanctioned. And I want to preface that this is a completely Texas thing. It may not be applicable to other states. They may have something similar, but we have a provision in the state where a school district can turn a teacher's name in for someone who breaches contract, who abandons their contract within the term period. What happens then if there is not good and sufficient evidence? The state will then find that the teacher has abandoned their contract, and they will put a suspension on your certificate for up to 1 year. That suspension stays on the record of that certificate for a lifetime. So people need to be clear about that. My recommendation, first and foremost, is check your school district's policy on what their resignation date is. Generally, it's 45 days before the first day of instruction in the state of Texas. Some school districts have relaxed that. Some school districts now have an August date. That's the deadline to let them know whether you're going to resign or not. If you pass that deadline, you know, I would certainly be talking with my doctor. You may have the option of taking leave, You may have the option of utilizing leave days because that's what they're provided for. If you are sick caring for someone else, there's a concern. All of those options should probably be looked at and exhausted. But if we're talking about doing something in a collective way, and there is the potential that may come down to educators may have to make decisions between their life and their livelihood, ultimately, then one of the things that should be happening right now is people should be talking to their peers, talking to everybody else on their campuses. Where does everybody else stand? This is one of the things that we're asking our building stewards to do now, is talking to our membership. Who feels comfortable about coming back and who does not? What is the ultimate decision that they're ready and able to make, and what information do they need to have to make that decision, so that we can be clear on it? Because one of the things that we have found is, you know, in our district, it takes about 900 and so people to be out before the district starts shutting down. If we can shut a district down for a Houston Astros a nationwide win, then we can certainly shut a school district down for the health and safety of our employees and our students. So we know what that number is, right? And there's another factor in this as well too. You know, how do they think that kids are going to get to school? Many of our kids are transported by bus. Most of our bus drivers, we're not even just talking about just the teachers, our bus drivers are elderly individuals. They often have healthcare provisions, and frankly, would I risk my life for an $15, $16, $17 an hour job? Likely no.
Right.
If they don't have people that can transport these kids, then how do you think they're going to get there in the first place?
Right, and it's also the substitutes. You talk about the lower wages and who would be willing to risk their life. Well, think about the nursing homes. That's where we've had most of the infection in this country. And a lot of that was because you had facility workers going from one facility to the other facility to the other, and they were infected. They were vectors, essentially. So you first have the problem of who's going to want to sub a class where the teacher said he had COVID symptoms, and now you're going to go into the classroom that he just taught. You're going to do it for $10 an hour or whatever. And then the other problem, if you do get those individuals, they could serve as vectors for this virus throughout a whole metropolitan area, because they are going from one school to the other school. You're not just subbing in one school. And I think that's another issue that hasn't really been talked about enough.
Yeah. Yeah, and to further the discussion on the economic issues, I think too many of our educators haven't in the past really connected what a lot of our federal policies and how they directly impact our schools and our campuses. One of the most important things right now, we are fighting tooth and nail to get the HEROES Act passed. The HEROES Act will allow for the additional funding to, one, stave off some of the potential job losses that we may be seeing coming down the road, two, provide the necessary funding to help do the additional cleaning and supports needed to do any kind of work, whether it's virtual only or in person at some point or level. So there are a lot of things that can be done to really help move those things along. The HEROES Act is another piece of the economic puzzle, because it would hopefully put back into place some of those things that are expiring right now, particularly the enhanced unemployment benefits for those lower wage employees like CNAs and bus drivers and subs you were talking about. But you know, also the people that can now be evicted. These are huge things. That's going to do nothing but make the problem within our communities worse if people don't actually have homes to stay in, particularly if they are sick.
We could pivot back to the topic of collective action. For those of you not in Houston, Zeph was not being facetious when he said the Astros win shut us down. We did. We got a whole day off because of an Astros parade. Now that Justin Verlander is not coming back, I don't think it will happen again. Sorry to say. But so when we, in our Facebook group, as we talk about, you know, people bring up the topic of work stoppages or strikes, and immediately you see 15 Texas teachers chime in with, it's illegal in Texas. Like, to even cut off the conversation. I am not now calling for a work stoppage or strike, to make that clear. But I did want to just bring up the topic of how could you talk to us a little bit about, let's say there was a grassroots movement, and teachers, to what extent can teachers even just talk about sick outs or work stoppages without endangering their certificates, and endangering their livelihoods? Because it seems to me that somehow in other states like Oklahoma and Arizona, where they've had recent stoppages, like, they were able to do it. And I think those are right to work states, but maybe you can enlighten us a little bit.
Sure. So a couple of things to start off this conversation is it was illegal for everybody at one point in time, and it is still illegal in places like West Virginia and Oklahoma. The second thing that I would say, particularly for those from Texas that are on the line, is you've got to look at your individual states, because though it may be illegal in these other states, Texas has some very harsh sanctions for engaging in this activity. You could lose your benefits. Does that mean you lose your retirement as well? They could sanction your certificate. These are all possibilities, but what they hinge on is they hinge on your ability to build power to either push back against those things or pull these things off. Like, for instance, we knew that it took 960 some odd people calling in on the Astros day to close the school district down. It's a case of numbers. It comes down to the fact that, you know, how many teachers would be taking the money that they've put into TRS out before it breaks the TRS system? How many people would have to, like, call off and be out before, even if they fired everybody and took their certificates away, they wouldn't have anybody to even teach the classes whenever they got back if they tried to do that. See, what they will count on is having a very small number of people who step out on the line and are willing to take the risk, but then look behind them to the left and to the right and don't see anybody behind them. So I highly recommend a couple things. Number one, as educators, let's talk about this in language that we're familiar with. Every educator is familiar with the hierarchy of consequences. You don't suspend a kid for not bringing a pencil to class. Your consequence matches the behavior and that you want to change. Well, let's figure out how we need to apply that to this place. We need to exhaust every other single potential consequence or every other action, escalating action, before we even think about talking about work stoppages. Not saying that anything is taken off the table, but, you know, do we need to file that lawsuit first and figure out whether that's going to work or not? Have we done everything we can possibly do to engage all of our members in the fight to push back on local elected officials and what have you? You know, are we making ourselves heard by everybody having the same day, time of the week that they're, you know, posting some common, you know, common thread, common post on social media, on wherever they can advocate back for? You know, are we taking what the Texas Teachers for Safe Reopening did in their caravan in Austin and bringing that to every single city in the state of Texas, so that people can engage where they are and find commonality, find community and network around those? Those are all things we talk about in being able to build power, build voice, and bring it up to the point where you can even consider anything like that. Frankly, without having people tested as to what they're willing to do, I would be very concerned about any small group of people stepping out of their line. We will fight for them. If they're our members, we will do everything we legally can to push back against these sanctions that could happen. But we would highly suggest that we work together, figure out what we start with, where we are, and move our way up before we get there. That's the way you work these pieces. That's the way you do it smartly, so that everybody can be brought into the fight. Because, you know, people may not be willing to start off at that high level of potential risk, but they may start off at a lower level of risk and may learn some things along that way. They may learn and understand what they're really fighting against and what's going on here, that changes their perspective and builds them to the point where before I walk out and just leave the profession altogether, you know, which is what generally happens in right to work for less states like Texas, is like, how can they actually work with colleagues to make it better before they make that decision? Because in school districts like ours, we have 2,000 to 3,000 people leave every year as a matter of recourse. Imagine if all of those people did that at one single time, all picked the same day, you know?
Right, and I've heard some very encouraging stories of people that went the, you know, the reasonable way. They went to their HRs, and enough of those people expressed their concern, and they forced those districts into going virtual. Just as a matter of logistics, the district couldn't open with that many people feeling uncomfortable and going that route. And my district has been very reasonable. I told them, you know, I'm a caretaker, I have underlying conditions, and they haven't set the date until September. So they've been very reasonable with me. But now what if you're living in a more rural area and people think COVID's a hoax and you're not going to get that kind of support? What do you do about that? And my other question would be, those contracts, are they really enforceable? Because when we signed those, the infectivity was way lower. And we were hired as teachers. We weren't hired as medical workers, hazardous cleanup workers. The whole thing seems what would fall under unconscionability. It seems like that's an unconscionable contract that even if you broke it, it wouldn't be, you wouldn't be subject to the punishments of breaking it because it was made under such a different circumstance, and it wasn't part of the deal when we signed it. So I would like you to speak to that. Are those contracts really enforceable? And would you be able to retroactively claim damages for lost income because they tried to hold your certificate?
So a couple things. Let me start off with the first part. In the other districts, I mean, the first and foremost place that they should be starting is talking with their colleagues. How many of their colleagues feel unsafe, and how do they collectively use their voice to share that? Because one person doing it is not going to be enough. Everybody going to talk to their principal or talk to their HR person, or all calling in or flooding the line saying what they're concerned about, is going to get their attention. If they're in one of those places where you may not have consistent belief amongst the teachers, and you're one of them that says, I want to go back, because we do have teachers that are in that perspective. They also don't necessarily believe that everything that's happening, or they want to go back. You know, are you now in a position where you have to make that decision on this contract? Well, like, that's a place that I would definitely start with, having a conversation with my HR director. School districts don't have to enforce that. It's a choice that they make to enforce it. If they're making the argument that the teacher legitimately does not feel safe and they do not want to go back, will they release them from their contractual duties? They have the ability to release them without having sanctions passed, because it is the school district that chooses to turn people's names in. I would try to get that in writing. That would be the first place that I would go to. Now, the second place, if they refuse to do that and you're not able to take some kind of leave or what have you, I mean, obviously, like, they need to be speaking to their representative, whoever their organization is that they belong to, because they're going to have more information about their local policies. But I would say, as a general rule, yes, it could be enforceable, because what is the changes in your contractual status that may allow a contract to not be enforceable would be things like, you know, they changed the number of days that you're required to work after the fact. They extensively changed your salary after the fact. Those are the types of factors that are directly related to your contract and to your work. I don't know of provisions that that allow for community level health concerns to be a rationale legally to do that. That doesn't mean that we wouldn't look at every single one and try to fight that for our members, because ultimately it becomes a decision of the State Board of Educator Certification whether they invoke those sanctions or not. So there are multiple steps in between. But the first and most important step, if people really are in that spot, they don't feel comfortable, and they have a district that believes nothing is going to happen and it's okay, then, you know, they should plead to them to release them from their contractual duties because they have the ability to do that.
Well, and the job description, is there provisions about to do, you know, medical observations? They're asking us to do hazardous cleanup in real time. Would that fall under a provision of a breach of contract when they're asking us to do things that just really aren't part of the job?
Yeah.
You know?
So that all depends on what your contract says. A lot of times there are contracts that say in other duties as assigned. There are some reasonable limitations to that. For example, like, you know, when they ask non-medical professionals to do invasive procedures of kids, we're generally able to stop that, at least in where we have local unions. There's some of those provisions that we're generally able to get pushed back. Without seeing them in writing, without knowing the circumstance, it's really difficult to say what type of standing you would have. Those are the types of things that I would recommend speaking to a local representative or an attorney who specializes in education employment law, because it is a special field.
Okay, I'm asking for others. Like, as I said, my district's been very reasonable, but there's so many other people I'm hearing, they're just terrified. They don't know what to do. And they just feel like it's a gamble, you know. If I don't have a job, I lose everything. I might as well risk my life because there's a chance I'll live. And that's just, the whole thing is so immoral. But that was my comment on that. And I guess I wanted to kind of segue into, I've talked to administrators, and they're terrified too. It's not just the teachers. They don't think this is a good idea either. So I wanted to kind of segue into West Virginia. Now, West Virginia did a work action. They're a right-to-work state, and they did what was called a work action, where they convinced enough of the community members, the administrators, superintendents, and they actually pulled off what amounted to a strike, and they got concessions. So I'm wondering how much you know about what's known as a work action, how that compares to a strike, and if that's even logistically possible to pull off in a huge state like this or in other states.
So there are multiple work actions. Many things could be a work action. You know, everybody wearing a button that symbolizes something that you're fighting for could be a work action. You know, under normal circumstances, not right now, because I would say obviously doing it virtually, but you know, a demand action meeting for your principal or your superintendent where people go in together, all those things can be work actions. That's part of that escalating list of activities we were talking about earlier. If you're talking about a work stoppage where they may be in their different levels of this, you know, what I know is in West Virginia, they maybe had some districts where they had fed up Fridays or what have you, where people did not go in on a Friday, and they took that day off and they took it from their leave bank to go personally to the state capitol and fight some of the fight that they were doing. We're in very different circumstances, and all of that takes a tremendous amount of work. I mean, the almost colloquial response I have for people as well is everybody knows at this point Rosa Parks didn't just sit on a bus. There was an entire infrastructure behind there. There were people ready to get her out of jail once she was arrested. They were expecting that, so that they had reporters ready to be able to go through this. A tremendous amount of work goes behind any type of work action, up to and including a work stoppage. So, you know, I think it's really incumbent upon the local level. The very first place to start is you have got to assess and test where your colleagues are. How many people are at the level where you're at? If you don't have a critical mass of individuals at that level, then what are you doing to either educate people to understand what their rights are, educate people to understand what we're truly facing, to ensure that they have enough information to make a transparent decision for themselves? Because the last thing that you ever want is to not have people know what they're getting into for any type of action that they take.
Yeah, I like that, Zeph. And I think, again, I'm not calling for a work stoppage, but I think this idea of building up your collective action muscles, so to speak, like even with small things on a campus or local level. Like if you're not ready to do that and you can't do that, then it may be premature to like let our minds go elsewhere. Even things like people are debating like wearing scrubs as teachers. Like some teachers feel like, no, like that goes against our dress code. I'm willing to show up in scrubs. I don't care. Just as a PPE measure and also as a statement, like that, you know, you are forcing me to do something that is outside the bounds of what teachers should be forced to do. So like something as small as that could be a collective action. So before we get to our questions that I know Chad is queuing up for us. So it's sort of a last topic, opportunity for you, Zeph, to make your pitch for AFT. I know some of the people here are listening are either not members of any sort of union or association. Some are members of NEA affiliates, which my understanding is, and like as a newbie union member, is that AFT and NEA are the two sort of true unions. And outside of that, you have associations that do not believe in collective action or do not engage in it. And I guess, can you just kind of give us a little lay of the land? Because a lot of teachers, and I've seen this comment over and over again, say, what's the point of being in a right to work state? What's the point of being in a union? We can't strike. There's no point. So I guess make your pitch to people who are thinking about it, what they should do, where they should go.
Yep.
We'll move on to questions.
So Mark, I'm going to take it from the kind of national perspective now, because when we talk about right to work for less, frankly, all 50 states are in a right to work for less situation now with the Supreme Court decision that made everyone there. The difference is are states like New York and California and others who had strong collective bargaining rights, who had done the fighting in the 60s and 70s that we're frankly doing now in right to work for less, original right to work for less states like Florida and Texas and Louisiana. They stayed at their almost 100% membership because they knew what that meant. They knew that dropping their union dues or not being part of it diminished our capacity to be able to have a voice and speak out. People often in right to work for less states like Texas ask, what are my dues going to, and this and that and another. Part of it is exactly what we're seeing now. We all pay into national dues so that we can support legal cases like in Florida that are where they're fighting back against this virus now. Just like the National Union helped us in Houston when we were fighting back on the EBOS evaluation metrics that were eventually ruled illegal. So that's what having that collective union is about. To your point, the NEA and the AFT really are the two only national organizations that are out there fighting. I know that some places they have more strength than others. In places like Texas, Harlandale has an NEA chapter where AFT may not necessarily have as strong of a voice. In Houston and many of our local areas, AFT is the main lead in this piece. But that's probably because that's one of the things that other places they're trying to do. The people that would like us to have less voice, would like us to still be living in their attics and still going by their dress codes, are trying to split people up, and we can't let that happen. We saw the damage that did in Texas. You have multiple organizations, ATPE, TCTA, all of these organizations came out of the NEA in Texas when the TSTA, Texas State Teachers Association, affiliated with the NEA, affiliated with a national organization that believed in collective bargaining and the right to strike. They wanted groups that had administrators in them that often were being controlled by the administrative level. I don't want to get too far off on that because on this COVID issue, I think that our administration and our teachers are completely together in many ways because, as was stated earlier, they're equally concerned about what's happening. But we also believe in the AFT, that educators, non-administrative educators should have a pure place to be able to move their voice. That's why we don't have administrators within our organization. That's why, and we do believe in collective action. We believe in unionization. We believe in collective bargaining, and that's a goal that we will have in Texas one day as we push forward so that teachers like yourself have the right to sit at the table as equal partners with their district leaders to be able to craft policies that best work for our kids, our classrooms, and our staff and our members.
All right, well, thank you, Zeph. This has been awesome, very informative. Just to recap a few highlights, we need to be talking to our fellow teachers. We need to be building consensus on our campuses and in our districts. We need to be in communication with all stakeholders all the time. Recommend joining a union, particularly a union that puts all collective action options on the table, though we're not calling for any, but with a deep history and experience in all sorts of collective actions, including ones that are very legal and very much about political advocacy, that you should be looking at how you can protect yourselves by documenting orders from your admin, and all sorts of options, life insurance, disability. We all need to be putting in our time this summer to protect ourselves. So do you guys have any last things to say? Thank you so much, Zeph, for sharing your time with us. This has been great.
Yeah, thanks, Zeph. Thanks, Michael.
Yes, thank you, Zeph. And I would like to say, you know, this isn't the optimal situation going virtual, but I would just quote Voltaire: "Don't let the perfect be the enemy of the good." And we shouldn't be asked to risk our life against our livelihood. It's completely immoral. And the shame should be not directed at us. It should be directed at the powers that be that are forcing us into this situation. And I think if one good thing came out of this situation is that it showed just how much society benefits from schools and teachers, and a hell of a lot more than giving all the money to billionaires and Wall Street bankers. So I just get that little jab in there. So join Teachers Against Dying today.